to be a good mom. May takot, pero nung lumabas na siya, unti-unti naming na-adapt as a first-time parent with my partner.
They will have separation anxiety. They want to cling to their mothers, and sometimes they don't want the school.
Most of the time at that age, actually, hindi pa sila masyadong worried. It's usually the mom or the lola yung nagdadala sa kanila.
They say the youth represents the future of our country. Therefore, the way we nurture and care for them today is key. From the moment a child is born, they undergo different changes. On today's episode, we'll delve deeper into the various developmental stages and gather parenting tips so together we can help shape a brighter tomorrow. I'm Dr. Freddy Gomez. Welcome to Med Talk Health Talk. Let's discuss some important ways in guiding our children effectively through society. And with that, to tell us more about this, let's welcome Dr. Zolina Baidid Cruz. She's a pediatrician from Chinese General Hospital and Medical Center. Pag-usapan natin, childcare ang topic natin for today, no? Let's start muna with some of the stages that parents should expect from their child. But instead of enumerating yung different steps, marami yun, ano? Yung mga milestones. Let's talk about some red flags. Kumbaga, what will prompt parents to seek consult pag hindi pa nagagawa ng anak nila yung ganito at this age?
So definitely we will start yung at 1 month, 2 months, you have your baby book, diba? To guide you, no? Pero most of them, natatakot na sila pagka hindi nagde-develop yung baby na on time. So first, kailangan makita mo muna na nagsa-smile yan at 2 months. Pagka hindi nag-smile ang baby mo, baka may syndrome o kaya meron silang muscle relaxation dun sa face nila, kaya hindi sila makasmile.
How about walking, being able to stand on their own, having that stability, especially that they are able to walk a little bit, although with guidance on their own? At what age dapat makita natin ito?
The earliest, makita mo yan, mga 7 or 8, minsan nakaka-stand up na sila.
Yes.
Pero pagka 1 and 2 months, hindi pa nag-walk, mag-worry ka na dyan.
Okay. How about talking simple words? Simple words at
1
what age?
year old, 1 word, 1 syllable. Okay? At 2 years old, 2 words, 2 to 3 syllables. So they can construct their own sentence na at 3 years old. Yeah. Pag hindi pa nagsasalita at 3 years old, matakot ka na. No words at all. Naku, mahirap yun.
When it comes to this age, syempre malilikot sila, they like to explore, at mahilig din sila maglagay ng mga bagay-bagay sa bibig nila, sa ilong, minsan sa tenga. When it comes to first aid, is there a correct way? Siyempre, panic minsan yung parent pag nalaman nilang may nakain, may nasubo. What's your tip when it comes to first aid, especially trying to prevent choking hazards?
The first prevention is don't you leave your child alone. Always be with your child. Yung iba kasi nagse-cellphone, hindi na napansin, nakasubo na pala ng something. Yung babies, no? Sometimes they want father to be taking care of their children. Why? Because the father are more focused. Kasi ang mommy, they are multitasking. They do everything, and then pag nakita na nila yung baby nila, nakasubo na pala ng something.
Now, in this day and age also, Doktora, I should say a parenting aid of a lot of parents is that of gadgets. Mas madali eh. Minsan, mas napapatahimik ang bata, mas kumakain kapag may gadget in front. What's your take on this? Is this healthy for the child in the long run? At what age is applicable? And how much exactly screen time should a child have?
Actually, the Philippine Pediatric Society is giving us the guidelines that you should not give your child any gadgets. You should not allow them to use it from birth until 2 years old. Limit or zero gadgets at least.
Parenting is a little bit more complicated than what a lot of people might think, and especially when it comes when the child starts to go to school or preschool for that matter. Ano mga tips ang mga pwede mo ibigay sa mga parents with children, toddlers going into preschool, especially for the first-time parents?
It's very hard to leave the children in the preschool at the first time. They will have separation anxiety. They want to cling to their mothers, and sometimes they don't want the school per se, the ambience or the preschool teacher. But you should be exposing your child to this environment. So, okay lang yan. Nararanasan talaga ng preschool yan. And they have to bear with it, no? A few months na may separation anxiety, they would cry. That's normal. Some children would have that, but some would be very much exposed naman. So, they don't have these problems naman.
And when it comes to parenting, in this day and age, of course, the mother and the father have busy lives at that matter. When it comes to parenting, should it be a 50-50? Mother and father ang nagbibigay nito? Or should the mother be more here? Should the father have more of a presence here?
Not really for more on a 50-50 basis, but kung sino yung mas available. Better if it's the parents talaga, themselves, no? The father, the mother. Especially kung mas kailangan ng mommy na mag-work and then the father should be taking care of the child.
It shouldn't fall onto one more than the other. That's a very important thing to understand here. So marami tayong natutunan here. After the break, Doktora, we will be talking to someone in their first-hand experience with raising a child. So this should be interesting. That's all when Med Talk Health Talk returns. So stay tuned. Many parents would agree that parenting is an overwhelming job, but they'll also tell you it's one of the most rewarding ones.
Hello, I'm Joanne Antonio. I'm a mother of 18 months old baby. Gabby is my first baby via cesarean section kasi breech baby siya eh. And also, birthday niya April 24 last year. She is 18 months old now. Nung buntis pa lang, afraid ako. Every woman wants to be a good mom po. Not may takot, pero nung lumabas na siya, unti-unti naming na-adapt as a first-time parent with my partner. So, ilan sa mga pinapriority ko about Gabby is first yung health niya, second is yung security and safety, lastly yung developmental milestone niya at her own pace. Pagka healthy baby, mas ma-enjoy niya yung life and mas mag-grow siya. Nag-resign ako sa work para ma-fulfill yung pagiging full-time mom sa kanya. From infant, syempre mahirap. Katulong ko yung partner ko. So, ayun, okay naman. Gumagaan naman. Together with my mother. Importante po yung i-check up si Gabby. Actually, quarterly kami nagvi-visit sa pedya niya. You can ask your pedya regarding to your concerns or if may i-raise kayong concern with your baby. Actually, every Monday to Saturday, sa bahay lang kami. Pero pag off ng papa niya, ayan, every Sunday, nagbabanding kaming tatlo. Family day, it's either mall or minsan nagta-trail and then swimming, ganun. First of all, one of my tips to my other moms, first take care of yourself para maalagaan mo na maayos si baby. Second, be flexible. Actually, flexible talaga lahat ng mom. Nakakaya namin kahit multitask. Third is enjoy every moment. I mean, enjoy life with your little one because every moment you can cherish that one as they happen. Yun po, first, syempre, lumaki siyang malusog, hindi sakitin. Tapos kung gusto namin lagi lang siyang masaya, even though a failure or success, pagpalaki siya ng palaki, nakasupport lang kami ng papa niya sa kanya. Actually, PPD, postpartum depression is real po talaga. You should ask for help po if kailangan talaga. Tapos, socialize. Even if you're mom, you should enjoy pa rin together with your friends or your families. Also, yung support sa partner is very important po talaga. As I said a while ago, quarterly kami bumibisit sa pedya niya. Aside from mamamonitor namin yung health niya, yan nga, weight and height, mape-prevent namin yung future health problems na in case na ma-tackle ni Gabby.
After the toddler and preschool years, your child will eventually start to hit puberty. Tips to guide them as they go through this stage when we return. So keep it here on Med Talk Health Talk. The onset of puberty can bring a lot of changes to your child. Now, as a parent, especially as a first-time parent, there are a lot of things that you can do in order to guide your child through this stage of development. And with that, let's welcome back Dr. Zolina Baidid Cruz. And we also would like to welcome Dr. Charmaine Sun, a dermatologist, and both are from Chinese General Hospital and Medical Center. Now let's talk about how puberty, the onset of puberty may affect a child. I'll start first with Dr. Zol. So ito na yung stage na growth spurt, ito na yung hormonal changes. It may be a welcome for a lot of parents, but maybe for most parents, ito yung critical stages. What kind of changes can parents, especially first-time parents, expect kapag nasa stage na puberty?
Yung acne, no? Yung pimples, lumalabas. And then, minsan nagkakaroon sila ng underarm odor. And then, minsan meron silang pain sa kanilang mga joints when puberty is coming, no? So, yun. And then, minsan, they're not aware na merong mga hairs. And then, their breasts becomes develop.
Now, going to Dr. Charmaine, binanggit ni Dr. Zol about these hormonal changes, especially when it comes to our skin. And one of the really more common ones is acne. How should I say it? Minsan, life-changing sa isang bata ang pagkakaroon ng acne. Normal ba ito? Can this be prevented? And if it does happen, what should a parent do?
It's actually very common. We see a lot of teenagers in the clinic. Ang acne can actually vary, no? Pwede tayong mild, moderate, or severe. And then it can also be inflammatory or non-inflammatory. So most of the time at that age, actually the teenagers, if early on, hindi pa sila masyadong worried. It's usually the mom or the lola yung nagdadala sa kanila. So they wanted to prevent na mag-worsen siya. So I think that's very important also because hindi rin kasi lahat that we see online, for example, in TikTok, Facebook, sa mga selling platforms, hindi kasi lahat ng products doon that works for one person would actually work for you also.
Now, when it comes to diet, marami nagsasabi kaya ka maraming acne kasi kinakain mo mamantika or masyadong maalat or even matamis. Does diet play a significant role in the production of acne, overproduction of acne?
Actually, according to the studies, there's no real clear-cut evidence na may high evidence that there's a correlation. Although, may mga ibang papers na lumalabas kapag kunwari, you eat a lot of sweets or now yung bago is actually dairy products such as yung mga low-fat milk, non-fat milk, pwede daw mag-cause ng acne.
What's the first step in just managing the oil production or the formation of more acne?
So usually, ang tendency is they keep washing their face to try and get rid of the oil. But actually, that's incorrect. You actually end up with more pimples or sometimes a lot of irritation. So more of nag-eczema or what we call contact dermatitis. And then it's also good to eat healthy. I always tell my patients to always get enough sleep. So lagi silang puyat looking at social media. So that's one of the things rin that can really aggravate acne.
Now, Dr. Charmaine, another common thing, especially at this stage, no, yung hormonal stage, puberty stage, is body odor. Let's first define or make it clear, ano bang ibig sabihin ng body odor natin dito? Is it, kasi everyone who sweats, there might be some form of odor, no? Pero in some cases, hindi pa pawis yung tao, may natural odor itong na-emit. Define for us what body odor is, and is it purely hygiene as an issue here, or are there other factors at play?
So in terms of body odor, I think all of us, whenever we sweat, we emit a little bit of odor. However, if it's something na it smells a bit different or the other person beside you can already really smell something bad, then I think that's probably classified as body odor.
What about, Doktora, yung mga dumaan ng puberty, nagkaroon ng malalang acne, nawala, pero nag-iwan ng mga marka sa mukha. Marami na siyang marka sa mukha. Minsan, habang adulthood, nandiyan pa rin. May magagawa pa ba tayo dito?
So in terms of the acne scars, no, I think what you're talking about is yung mga scars na butas-butas yung face, yung medyo lubog. So I think there are ways with the onset of technology, ang dami ng mga binibenta or pwedeng gamitin or mga procedures, yun lang nga, hindi rin siya ganun kabilis. It depends on the extent of damage. So kapag malalim na malalim yung scar, then medyo mas intensive yung treatment na kailangan. Pero it's still possible.
Now, Dr. Zol, another thing that's common, especially among women, are menstrual cramps. Common ba dapat ito? Is this part of growing up, magkaroon ng menstrual cramps? Can parents help their child deal with this in a less traumatizing way, especially those who have severe cramps?
Definitely yung mothers, they have already experienced it, no? So kung ma-experience ng mga daughters nila, it would start with a little pain, no? When they start their, we call it menarche, no? Magkakaroon sila ng konting pain. And then when they grow older, mas medyo sumasakit ng konti. If it would be worse, na hindi na talaga too painful to tolerate it, syempre the child or the teenager will ask the help of the mother.
Pero when it comes to gamot, yung gamot ba ng mother na adult na pwedeng inumin, pwede rin bang inumin ng isang bata?
Sometimes paracetamol will do, no? Kasi it's very safe, no? But pag hindi na kuha ng paracetamol, then definitely hindi pwede mag-add ng additional because other pain relievers will be very harmful, no? Sometimes they cause complications that worse than what we are dealing with, yung sakit ng cramps lang.
So marami talaga tayong natutunan in this episode in how to really raise a child the good way, in the proper way. But before we go, do you have any messages, any tips for our viewers? I'll start first with Dr. Rizal.
So for puberty, we're going to deal with this at lahat po ng mga parents have undergone yung mga changes na ito, kaya kailangan we have to be very cautious, no, not to use things na over the counters, no. Just ask the pediatrician.
Very good. And Dr. Charmaine, any tips, advice para sa mga, not just the parents, but also if ever there are kids watching, especially nasa stage sila na marami silang nakikita sa balat nila, what's your advice for them?
I think what you should always remember is to do basic, proper skincare. And if there are problems in the skin, it's always best to consult a board-certified dermatologist. Kasi just remember, habang maaga pa lang, if you try and stop the problem, mas less yung damage.
Okay, and with that, I'd like to thank Dr. Charmaine Sun, dermatologist, and Dr. Zol Cruz, pediatrician, both from Chinese General Hospital and Medical Center. Thank you for joining us here on Med Talk Health Talk and sharing your expertise with our viewers. Children experience so many physical and emotional changes. One of the best things you can do for your children is give them a safe space. Let them know they can have open conversations with you without fear or judgment. I'm Dr. Freddy Gomez. Thank you for joining us here on Med Talk Health Talk.